Hi, good evening. Today is day 8 of daily NEET PG practice. So, every day we do the same thing. It's been 7 past days. We have almost discussed about 150 MCQs, and today we'll be discussing around 20 MCQs. Similarly, like it's just daily drill. We post all the questions, 20 MCQs, in our Telegram channel every half an hour starting from 8 a.m. in the morning. And to be part of this Telegram channel, so this is the QR code, you can just scan it, or you can also join by using this link, which I just posted in the live chat. We will post only questions, and at the last question posted will be at around 5:30 p.m. Then you will have around 2 hours to answer these questions. And at exactly 8 p.m. today, I started little early because I have to join another session. I'll be participating as a judge in a demo by youngsters demonstrating agentic AI. So my other interest is agentic AI in healthcare. So obviously, Medaffin ecosystem is built as an AI first platform. Medaffin Academy is part of this ecosystem. Okay, yeah. So that's the drill. So I request whoever is participating, please answer the questions, and also if you have friends who are looking to have some practice sessions daily on daily basis, and they can join our community. So this is the QR code again, and if somebody is watching this live, please also share this link with your friends who may be having dinner or just relaxing right now, so that they can just hop on and watch this live streaming. So without further ado, I'll start today's session. Let's start with first question. So the first question is an image based question. Please identify the instrument shown in the image provided. So what we do here is we will just discuss the questions and the answers, along with how many percentage, how many people, like what's the percentage of people who has kept it right, and what is the percentage of people who has kept it wrong in the group, right? The final explanations and full explanations will be available in the group. If you join the group, we will post it around 9 p.m. so that you can have a reference, quick reference. So 20 questions per day, and we will increase it, and we are planning to do around 1500 to 1500 MCQs, which are from previous year question papers, high yield topics, so that unknowingly you will be revising yourself, and this will definitely help you give some edge in NEET PG, which is on August 30. Okay, so the uh, first question is image based. Please identify the instrument shown in the image provided. So there are four options. 80% has selected as Morris retractor, and 20% has selected as Zernis retractor. Okay, so the correct answer is Morris retractor. Like I said, the complete answer set will be posted as a PDF. And let me show. This is the yesterday's PDF, and day before yesterday we posted PDFs. So every day we post questions, we discuss them, and post the explanations at the end of the session at around 9 p.m. Yes, coming to the next question. A 60-year-old postmenopausal female patient with a previous history of Colles fracture comes with complaint of lower backache. On evaluation, her T score was minus 2.5. Which of the following statements are false about the management of her condition? Okay, and around 20% has given the answer as uh, teriparatide should be started before supplementing with bisphosphonates. 80% has given answer as bisphosphonates are not given for more than a year. 0% other options are oral vitamin 3 D3 is given along with oral calcium. Calcium requirement is 1200 mg per day. Okay, and the correct answer is actually uh, bisphosphonates are not given more than 1 year. So the question asked is which of the statements are false. So you have to be very sure, right? Like you have to understand the question, think about what they're asking, then only answer. Like so if so it means the other statements are correct. So what happens in examination is you may not read the question and you may think that the first option is correct and you will keep that. So that way you will be losing the marks even though you know the subject. So read, understand, wait, and give answer. Coming to the next question. A 45-year-old male was taking digoxin regularly, and on routine checkup, the plasma concentration was found to be 4 nanograms per ml. The treating physician wanted the concentration to be 1 nanogram per ml. For what duration should the drug be stopped in order to attain the same? If the half-life of the drug was 40 hours. Okay. The options, most of them has given option as 40 hours and 80 hours, out of which 80% has given option as 80 hours, and 20% has given their option as 40 hours, and the correct answer is 80 hours, right? And the proper explanation on how to calculate this half life and everything will be given in the explanation at the end of the session in the Telegram channel. So please, if you want to have that PDF, please subscribe to the Telegram channel. This is built just the sole purpose of this Telegram channel is to post question, discuss them, and give resources. We don't advertise, we don't sell any products. Okay. Yes. Coming to the next question. A child, while playing outside, plucked a fruit from a plant. He was brought to hospital with complaints of abnormal behavior, hot, dry skin, painful swallowing, photophobia, and not being able to pass urine. Classic signs of, datura poisoning. Which of the following would be true regarding the poisoning and treatment in this case? 100% has given answer as datura and physostigmine. So that's a great thing. So it means it's an easy question, repeated question. So the answer should be easy. So these are the questions, like you should not wait for so much time. Just read the question, get the answer, or give the answer, and move on to the next question. Coming to the next question. A patient presented with fever and neck rigidity. The CSF analysis reveals low glucose, high protein, and polymorphs. The gram stain revealed pleomorphic gram negative bacilli. Which of the following will be true regarding probable causative organism? Okay. So now coming to the options, again 100% has given the same answer. That is, it shows satellitism phenomenon with Staphylococcus aureus. Okay, the other options are NLF colonies on McConkey's agar, sensitivity to bacitracin, alpha hemolysis on sheep blood agar. Okay, and the correct answer is option A, and almost 100% has given the correct answer. Coming to the next is an image based question. We do post more image based questions so that you will have more practice, and we are assuming that this time around 25% will be image and video based. So that amounts to somewhere around 45 questions in 180 questions will be imaged and video based. So we want the participants in our channel to have more image based questions. Okay, this is image based question. A 70-year-old female patient presents with pain in thigh during walking. Investigations reveal the following finding as given above. What will be the best surgical management? The options are PTA with stenting. Second option is femoroiliac bypass. Third option is aortofemoral bypass, and the fourth option is aortoiliac bypass. Okay, 75% has given answer as PTA. Okay, with stenting, and 25% has given as aortofemoral bypass. So here 25% has given it as a wrong answer, right? And 75% has given it as the right answer. So it's a tricky question. So the benefit of this group is, like, you can know like which questions are being commonly marked as wrong answers, right? So that you can concentrate on those questions. The reason being, like, majority of the people are wrong. The chances of that uh, you know leading up to who getting confused on the same question in exam will also be high, so you can concentrate more on these subjects. Coming to the fourth question, a patient is brought to casualty following road traffic accident. On examination, the patient is conscious, BP is 90 by 60, respiratory rate is 40 breaths per minute, and pulse rate is 120 bpm. The X-ray is shown above. What is the next best step in the management? Okay, we have four options, and 80% has given the answer as chest tube insertion, and 20% has given answer as pericardiocentesis. The correct answer is chest tube insertion because it's clear case of pneumothorax, and we need to put chest tube under air seal, water seal, so that the collapsed lung will become slowly normal. Coming to the next question, another image based question. A 66-year-old boy came with history of recurrent urinary tract infections. Imaging was done and is shown above. What is the diagnosis? And the options are vesicoureteric reflex, urinary bladder diverticulum, urinary bladder hernia, vesicocolic fistula. Okay, the correct answer is vesicoureteric reflex, and everyone has given the correct answer. There is bilateral hydronephrosis because of the reflex. It is giving a back pressure to the both ureters, leading to hydronephrosis. Coming to the next question, again image based question, histopathological slide. A 50-year-old man presented with blurring of vision, urine examination showed proteinuria. Fundus examination showed dot and blot hemorrhages, microaneurysms, and cotton wool spots. Histopathology of the kidney is shown above. What is your diagnosis? Again, almost 80% has given the answer as Kimmel-Steele Wilson disease, and 20% has given their answer as focal segmental glomerulosclerosis, right? And the correct answer is Kimmel-Steele Wilson disease. The other options are renal amyloidosis, and fourth option is lupus nephritis. So the correct answer is Kimmel-Steele Wilson disease. Again, for correct answers and full explanations, please follow our channel. Just scan this QR code, and I think you will be getting an entry into the channel. Coming into the next question, again an image based question. An HIV patient with fever and chronic diarrhea presented to the OPD. His stool was examined and it showed following oocysts. Identify the components used for staining the stool. Okay. Uh, so again, 20% has given answer as crystal violet, iodine, acid alcohol, quinone carbon fusion. Okay, and 80% has given answer as quinone carbon fusion, acid alcohol, and methylene blue. And the correct answer is quinone carbon fusion, acid alcohol, and methylene blue. Coming to the next question, what is the most common pulmonary manifestation of SLE? Again, four options: shrinking lung syndrome, pleuritis, intra-alveolar hemorrhage, interstitial inflammation. And the question is, what is the most common? Okay, that's the question, right? The most common pulmonary manifestation of SLE, systemic lupus erythematosus, is pleuritis. That's the correct answer. So 60% has given right answer, and the other 40% they might have confused with the most common and the complications maybe. Coming to the next question regarding the mobile medical unit MMU, which of the following is or are correct? Okay, so government operated fully, capital and operational support for states, staff, one of each medical officer, nurse, lab technician, pharmacist or admin, and driver and support staff. Four option is all of the above are correct, and everybody has given correct answer 100%. It means it's an easy question. So this is just our request to our community members, and I'm also requesting you, please join our community Medaffin Academy, and we are building the world's biggest healthcare networking platform, and Medaffin Academy will be part of that. So you'll be, once you are part of this Medaffin Academy, you will obviously become part of Medaffin ecosystem. Has so many other applications and products, so that you can use them for your betterment of career. Coming to the, yeah, this is our link to the channel. I'm again posting in the live chat. If somebody wants to join, please join. Coming to the next question, calculate the net filtration pressure across GBM, GBM for a patient with glomerular ultrafiltration coefficient 6, glomerular capillary hydrostatic pressure 45, glomerular capillary oncotic pressure 20, and Bowman's capsule hydrostatic pressure 10, and Bowman's capsule oncotic pressure 0. Okay, the correct answer is 15, and the proper explanation and how the 15 is achieved will be shared as a part of PDF explanation at the end of the session at around 9 p.m. Okay, so please join our channel so that you can get this PDF. Coming to the next question, again another image based question. What will be the level of origin of the nerve which supplies the muscle marked in the given image? This is the muscle mark, right? So ocular muscles. Okay, okay, the options are red nucleus, olivary nucleus, pyramidal decussation, and fourth is subthalamic nucleus. And the correct answer is red nucleus, and 80%, 86% has given correct answer. And previously also 100% has given correct answer. It's a very good thing. So it means calculations are easy. Okay, coming to the next question. Choose the wrong statement about Plasmodium species. Drug resistant falciparum is seen in India. Uh, Presence of Duffy blood group antigen is protective against Vivax. And severe malaria with shock is called algid malaria. Fourth one is relapse is seen in Plasmodium ovale. Okay, this the question asked is wrong statement, not the right statement. Again, same thing. Read the question, don't jump to the conclusion. Read the question, understand it, wait for 1 second, then give your answer. Right? Smooth specialist, hi. Smooth specialist, hi. How are you? Yeah. Thanks for coming and watching. Yeah, the correct answer, I mean, correct in the sense like the wrong statement is presence of Duffy blood group antigen is protective against Vivax. This is the wrong statement about Plasmodium species. And all the explanations will be given at the end of the session in our channel. Again, hi Smooth Specialist, if you are looking to join some academies, I mean, this channel, please, this is our QR code. You are most welcome to join our channel. And I'm also like calling for experts, right? Anybody who wants to be part of this channel and teach to medical students and aspirants, or give good webinars for general education, you are also welcome to be part of this channel, right? I'll be happy to associate with like-minded people. So yes. Coming to the next question, protozoa seen inside the Kupffer cells of liver. Okay, and 25% has given answer as Plasmodium, 75% has given their answer as Leishmania, and the other options are Babesia, toxoplasmosis, not taxo, sorry, toxoplasmosis. Okay, yeah, previous question 71% has given wrong answer as presence of Duffy blood group. So it is also a tricky question then. Yes. Coming to the question, and the correct answer is Leishmania, right? Leishmania is the correct answer, and explanations will be provided at the end of the session. Coming to the next question, I think a woman presented with complaints of greenish discharge. On examination, she had strawberry cervix and vagina. what will be the drug of choice for the infection? Okay, the options are ceftriaxone, metronidazole, isoclavir, and fluconazole, and everybody has given the answer as uh, metronidazole. The reason being, it is a case of trichomonas infection, right? Trichomonas vaginalis. Okay, that's the infection, and most commonly it is the reason for the strawberry cervixin. There are a lot of strawberry signs. We also shared some of the materials like strawberry, so where you can see strawberry signs, strawberry tongue, strawberry cervix, and strawberry, I think skin. So a lot of things are there, so it is shared. So we will be sharing a lot of this information in coming days. The sole purpose of this academy is to make sure that it acts as a rapid revision for all the NEET PG aspirants. We are not selling anything. We don't want you to buy anything from us. We do have products, but we are not advertising. Yes, coming to the next question, again an image based question. Just observe this image because streaming can allow only some part. Okay, this is the image. If you see, dilated bowel with a air filled bowel, right? Coming to the question, an elderly lady presents with abdominal pain and distension. She has a history of scoliosis. Given below is a erect abdomen radiograph of the lady. What is the most likely diagnosis? 75% has given their answer as large bowel obstruction due to sigmoid volvulus. Okay. Second the best answer given by them is large bowel obstruction due to fecolith, cecal volvulus, and fourth option is small bowel obstruction due to bowel perforation. Bowel perforation results in gas and diaphragm. That's another story. So here the correct answer is large bowel obstruction due to sigmoid volvulus. That's the correct answer. So if anybody is watching our channel, please subscribe to our YouTube channel also. That will encourage us, and that will also, give us some kind of mileage. So please also like and share, comment if you are here. So that will be helpful. So it's almost like we started today early rather than 8 p.m. We started today at 7:45 because, like I said, I have one more meeting to attend. So I had to prepone this session today. So only last two questions right now. I guess like we can wrap this up early, and I'm trying to, I think somewhere around 40 minutes, so not even 40 minutes, 25 minutes, I think we started. A 40-year-old male presented to neurology OPD with complaints of imbalance while walking with closed eyes and has to lift his foot and stomp on the ground to walk. Okay. His examination reveals loss of fine touch and 2-point discrimination. The lesion noted in the medial lemniscus is the continuation of which tract? Okay. 80% has given their answer as fasciculus gracilis, and 20% has given their answer as spinocerebellar tract. The other options are spinothalamic tract and spinotectal tract. Okay, four options, out of which 80% has given fasciculus gracilis. Okay, and that's the correct answer. Okay, like I said, if you want more explanations and correct explanations, please join our group. This is our QR code, and I also have shared the link to the channel in live chat. We will post all the questions along with their answers and full explanations, and we will repeat this for another 25 days. So this is almost 8th day we are doing it, and we will repeat it coming 25 days more, right? We want to make sure that the NEET PG aspirants will get maximum benefit just by being part of this channel and revising questions faster, and getting material that are very based on the high yield questions, right? That's the one thing. And second thing, we are also planning to do live grant test on coming Sunday. so that you can join and you can have an interactive session, participate. Last live session was a very successful one, and we want to do it again this time in coming Sunday from 4 p.m. If time is good. Coming to the last question, this is actually a video based question. Okay, if you are in the channel, you could have observed it properly. Let me read the question. A 45-year-old male presented with progressive dysphagia to both solids and liquids. A fluoroscopic barium swallow video shows a dilated tortuous esophageal body that tapers smoothly at the gastroesophageal junction into a distinct bird beak's appearance with very little contrast entering into the stomach. The underlying pathogenesis of this disorder is the degeneration of inhibitory neurons within which specific structure. The question is very extensive, right? And obviously it is achalasia cardia. There is some degeneration in uh, cells which resulted in this kind of picture. Okay, the options are submucosal mucinous plexus, myenteric plexus, that is Orbach's plexus. The other options are vagus nerve, dorsal motor nucleus, and the fourth option is nucleus ambiguus, right? The correct answer is myenteric plexus, that is Orbach's plexus. That's the correct answer. The structural defect or degeneration of the Orbach's plexus is a reason for achalasia cardia and this bird beak appearance in barium swallow. Okay, I think that's it. We have completed everything in almost 28, 27 minutes. So this is the fastest we have completed. I request if you are watching this, please subscribe to our channel, Telegram channel. Every day we will post 20 questions, and every day at the end of the session we discuss these questions, and we will also post full explanation as a PDF so that you can download and have a quick reading. So I suggest you also join, also help to grow our channel. We want to reach 100 subscribers by this weekend, and I want your support. I am and if you join, right, that will give us morale, or that boosts our morale, and definitely we will be working harder. Obviously we are working harder. I do a full-time job in Abu Dhabi. I wake up at 5:30, prepare all the questions, schedule them, do the job, come back and do the live again. So that will be an encouragement if you join our channel. Okay, thank you all, thank you very much.